The bullocks still plod along the dusty roads as they have always done. The farmers still plow their fields as they have always done. The women work by their sides, cutting the ripe grain. And the bullocks trample the harvest on the threshing floor. India's people, 4 out of every 5 of them, still live in the countryside, and their lives are shadowed by poverty and hunger, illness and early death. This is the story of the comprehensive rural health project in Jamkhed, India. It is the story of once neglected villages and once forgotten people. It is the story of 2 Indian doctors, Raj and Mabelle Arole, and of their dedication to India's rural poor. It is the story of healing and health, of change and of hope. Let us begin here in the village of Arungao. The mother is blind in one eye. The baby has a bad eye infection and shows signs of the protein deficiency disease, kwashiorkor. Where can these people go with their health problems? The cities where medical facilities are to be found are too far, too big, too noisy, too full of strangers. And the city hospitals are frightening to country folk. They are also too big, too shiny, too cold, and too full of strangers. Then where can village people go with their health problems? When there is no other alternative, the only hope for a parent with a sick child may be someone who practices magic. But there is another way, the way of human skill and caring. Starting with the imperatives of their faith, Raj and Mabelle Arole, graduates of Vellore Christian Medical College, a husband and wife team with the highest qualifications, have chosen to live and work among the people who need them most.
These children represent health problems in rural India. 80% of these problems are preventable. These children should really not be sick. Now they are malnourished, and with this malnourishment, often they fall prey to other illnesses like diarrhea, diphtheria, whooping cough, etc.
Even a simple form of medical treatment is not available to these children nor to their parents. We have been wanting to find a healthcare delivery which does not need high and expensive medical technology, but one which is simple and more appropriate to their way of life.
The western part of the Deccan Plateau, with its thin soil, meager rainfall, and hunger, is the area where the Aroles work. Their headquarters are in the village of Jamkhed, a market town 250 miles east of Bombay. Its weekly bazaar brings hundreds of villagers from miles around. They come with everything they have that someone might want to buy. Goats, bullocks, buffaloes, siso, spices, eggs, baskets, and especially grain. The Aroles set up their first clinic on the edge of the market square. The building was an abandoned veterinary hospital donated by the village, hardly more than a string of sheds. Soon, grateful patients gave land at the edge of town, and the doctors built a 30-bed hospital, a simple structure made of corrugated metal sheets. The cross on the roof was put up by the Hindu builder who said that the people should know why the Aroles had come. From the beginning, the two doctors stuck to a pledge they had made while students in public health at Johns Hopkins University Medical College. No more than 30% of their time and energy should go for curative work. 70% must be spent on community health. Therefore, the work at Jamkhed Hospital is limited almost entirely to emergencies. The old man being taken down from the bullock cart has pneumonia, and he's desperately ill. The wards present an assortment of other emergencies: poisonous snake bite, suspected cholera, tetanus, attempted suicide. A young boy who fell off his bicycle has a nasty fracture of the arm. Nurse Godke reads the X-ray, for she will reduce the fracture. No doctor is present. The patient is put to sleep. The anesthetist is a young man who has never been to school. He can't read, but he has been taught by the Aroles to handle anesthesia. Probably there will never be enough fully trained medical personnel in rural India, so the Aroles delegate their work, training their nurses and other staff to handle many procedures usually entrusted only to doctors.
Okay.
Nearby in the hospital is an elderly patient who is pleading for sight. Are his cataracts operable? Cataracts are very common in India. Indeed, many kinds of eye problems are common. Dr. Raj gives the staff a lecture on the structure and health of the eye. The entire hospital staff attends: nurses, lab technicians, leprosy worker, agriculturists, even the gateman. They all must be able to answer the patient's questions, Raj explains. A decision has been made. The man with the cataracts can be operated on. Dr. Mabelle will perform the surgery. The whole team prays before they begin.
Amen. There is no capsule? No.
Dr. Mabelle removes the cloudy lens and completes the operation. But dramatic as the hospital's curative work is, it is not the main focus. The Aroles formula is no more than 30% of time and energy for curative work, 70% for community health. The Aroles